That night I got a phone call from the doctor. They told me that Amy's condition had deteriorated to the point that there was some concerns that if she would survive. That was probably the most difficult moment of it.
I first got sick back in December. I started getting a cough, so I worked from home, started to develop other symptoms, fever, headache, some body aches, and realized pretty quickly that I might have COVID. I spent about a week at home trying to work and get better. And after, as I progressed, I got sicker. I had a point where I went in to take a shower and partway through got really winded and had to sit down, and I couldn't get back up by myself. And I think that's when my husband started getting worried.
I reached one of the RNs in the emergency department here at Cass Regional that I had known. Actually, in fact, one of our neighbors. And I told her what Amy's symptoms were. And her words to me were, "Doug, think about what you just told me. Amy needs medical treatment and she needs it now. Hang up the phone and call 911. Within a few minutes, the ambulance did arrive. They loaded her in the ambulance and took her to the hospital for advanced treatment of the COVID. And that was the last time. Last time I had seen her for a little over a month.
When I went to the hospital, my oxygen levels were certainly lower than normal. They immediately put me on oxygen. I started to worsen over that week's period of time. And on Christmas Eve, they decided that I needed to be on a ventilator. I was ready to do it on Christmas Eve because I was afraid that when I was put on the ventilator, that I was going to die, that there was a good chance that I might not even survive getting intubated. That's something that's a really risky procedure, even when you're well. I wanted to do it on Christmas Eve because I didn't want my family to have to remember me dying on Christmas Day.
They had provided me with an access code that I could call and speak with her nurses about her condition, which I did several times a day. And they told me that Amy was not responding well to the treatment that they were giving her, that she was not making any progress at all. In fact, the condition was worsening.
In early January, they decided that they were going to try to take me off of the ventilator, and I worsened over the next 6 to 8 hours and had to be re-intubated. And that was when they decided that they were going to have to do surgery to put in a tracheotomy.
They told me there were some decisions that needed to be made and asked me that should Amy code, in other words, should she stop, her heart should stop, they wanted to know if I wanted them to do CPR. And they told me, unfortunately, things had gotten to that point, that nothing they were doing to try to reverse the effects of her crashing were helping. I told them, of course. I wanted her to have every opportunity to survive this. I called back and I got one of the nurses and I asked, what's going on? No one's called me. The nurse told me that things got bad, real bad, that Amy wasn't responding to any medication they gave her, that she was spiraling down literally to the point that her heart had nearly stopped, that they had put the hospital bed she was in the CPR position. And he said it was like when they dropped the bed flat to do CPR, it was like somebody had turned on a switch and Amy just started again. That she began responding to the medication and things were getting better.
Once I was awake, they felt like I was stable enough to be able to go to a long-term acute care and spent about a month weaning off of the ventilator. The whole transition to trying to breathe on my own was incredibly difficult. And there was a risk I wasn't going to be able to get off the ventilator, that I was going to be on a ventilator for the rest of my life. And that was, to be frank, terrifying.
Amy came home on oxygen, and we don't know if she'll ever get off of oxygen. Her physical limitations are such that she tires easily. Her doctors told her that we really won't have any idea of where you're going to land physically for at least a year.
I'm much better, but I still am nowhere near what I was pre-COVID. And I'm realistic enough to understand that I'm likely not ever going to get back to that point.
We got her home. She was home maybe a week, and she wanted the vaccine right then. She said, I need to be on the list, and Cass Regional had a vaccine clinic. We got up one morning and she says, you're taking me to the hospital. I need to get the vaccine.
It's important to remember that your personal decision impacts others around you. So if you choose not to get a vaccine and you get sick, you might not feel bad. You might have a mild case, but you might also give it to your mother or your child who's not old enough to be vaccinated, or to a sibling, and they might get a severe case.
This is very real. This is not a hoax. This is not some propaganda. This is something that is very, very real. I can't emphasize that enough. I can't stress enough to people to do everything you possibly can to prevent yourself or your family member or a loved one of having to go through this. The vaccine works.
It's serious. Remember that, it's serious. And one person in your family getting it at this severe of a case, opens up people's eyes to it. Don't wait until that happens. Don't wait until it's too late. The best thing that you can do is to get vaccinated, to protect yourself, protect your families.